This is my talk about CRPS syndrome in 40-year-old girl. Pretty unusual. I saw several in my life, but this was pretty unusual, and that's what I would like to share with you. So CRPS is chronic neurological condition that characterized by severe spontaneous pain, allodynia, vasomotor dysfunction, motor impairment, swelling, and autonomic instability. And the treatment modes include medication, various medication, physiotherapy, psychological therapy, and neuromodulation, including spinal cord stimulation, and some recommended ketamine coma. And yes, amputation sometimes is a tool for this condition, although it's controversial. So 14-year-old girl, February last year, had minor trauma, most probably ankle sprain. She was treated with a splint. She had short course of physiotherapy. Pain became worse. She had peripheral block in some of the hospital in the middle of the country and stopped to walk after this. And that's what I saw in February this year. Apparently, there is normal family. She had unsuccessful treatment in our pain clinic in Rambam, which is one of the best in country. 2 months rehabilitation in Riyadh. Twice consulted in Sheba Pediatric Rehabilitation Center there, and for various reasons, the conclusion was that rehabilitation impossible. And pain and swelling, gradual climb above the knee joint, limb completely non-functional. It's very important that she used impression that leg, not my leg. And this is the area of normal sensation. So it's practically at mid-thigh. She has some discharge from skin folds. She can't wear socks. She can't cover her leg completely. She can't do any shower. I was several times on call, and when she was admitted in pediatric department, I went in the middle of the night and I saw that she's not sleeping. She's sitting for several nights. She's sleeping at daytime, okay? But always sitting, okay? No, she can't put her leg on the bed. So this is, by the way, in operating room under anesthesia. This is how it looks like. If you remove the pressure, it's jumped again in the same position. I did research in the literature. The biggest, it was published in a GBGS article that reviewed 160 articles, 111 amputation, 107 patients. The reason for amputation was pain. In 80%, 72% dysfunctional limb. In one study, recurrence of CRPS in the stump was in 31 of 65 patients. This is most worried for me, okay? Phantom pain was in 18 patients. I don't remember how long was cohort. Nevertheless, 33 or 49, one study were able to fit prosthesis. They all belongs to level 4 evidence, and there was conclusion there is no clean answer about benefit of amputation. I think that the best article came from Haifa, from our hospital. They published in GBGS Briti. Doron Norman, Reggie and Scott, we saw him yesterday. He's the head of the department, resident of Professor Rice. And Elon Eisenberg is a dean of medical school in Technion, my friend and mountain biker. They compare two groups, 19 patients with amputation and 19 patients that amputation was considered but not performed. And there was pretty similar age, pretty similar sex in both groups. All patients filled questionnaires. Short form, kill me, I don't know what is it. Short form of McGill pain questionnaire is from your place, the Professor Hamdi. Beck depression index, inventory index, clinical demographic questionnaires, and so on. The results were that amputation group showed consistently better results in all parameters. So the take-home message, amputation should be considered for patients with intractable CRPS. So this is another study. So I hesitated what to do. I never in my life, I was urged to go for ethical committee of the hospital, and I was in minority. Once in 5-7 years, if I don't know what to do, I call to my guru, my mentor, Professor Daniel Rice, who undoubtedly had more experience than anyone, many of you, if any, have on the globe. And I sent him pictures. I explained what about, and he said, go do amputation 3 centimeters above the level of sensation. So that's what exactly we did. This is 3 centimeters, and this is sciatic nerve. We tried to cut it as proximal as possible. This is how it looks like. So in conclusion, there is a parallel syndrome of body integrity identified disorder, a condition where patient feels that one of the limbs doesn't belong to his body. And Professor Rice told me that some animals, reptiles, lizards, salamanders, African spiny mice, discard body part as a self-defense mechanism. And some humans cannot do it. Some may even regenerate limbs. Look at this. This is lizard, and he can discard the tail. So the follow-up, 4 months. I know it's too short. Uneventual stump healing, no swelling, normal sleep, no phantom pain after 4 months, successful rehabilitation in Sheba. She's now waiting for definitive prosthesis and return to school, after 4 weeks. Return to school. And you know what? Every week I receive something, but this is most touch for me. Dear Professor Eidelman, thanks for giving me back hope. And I promise to visit here without camps and scratches. That's it. Thank you.